Hi, it's Dr. Berardi, and we're going to talk about Botox and fillers. So we've heard a lot about it. Obviously, it's been around for decades, and there's the generalization is Botox is for wrinkles that are caused by animation, right? When we wrinkle our forehead, we furrow our brow, we pucker our lips. Botox can help reduce the action of those muscles and therefore reduce the wrinkles, right? And maintenance is important because if you do it once, 4 to 6 months later, you need it again, or else those wrinkles are going to reform. Filler is generally for places where we want more volume, possibly to help lift areas, like popular places in the cheeks. We put volume in the cheeks. One, if you don't have well-defined cheeks. Two, if you need volume there to help lift. Now, there's always a balance, right? There's what's our clinical endpoint? Our clinical endpoint is to look more youthful, is to balance the face, it is to lift what has fallen. However, that's where some people are getting it wrong, where great expression is all you have is a hammer, everything is a nail, all right? So if you go places like a med spa where all they have is filler and Botox, you're going to get filler and Botox, whether you need it or not, because in some instances I am seeing a lot of overcorrection out there, particularly in the cheeks, particularly in the lips. For the cheeks, sometimes you don't need filler, you need skin tightening because the face is falling, so you put filler in the cheeks to try and pick it up, but then if it's out of balance, if it's not proportionate to your face, then it just looks odd. So skin tightening is some consideration, especially in an older person, versus filler. So just know Botox and filler is not the answer to everything. If you're beyond that point, then we talk about surgical intervention or even skin tightening procedures. You see a lot of this in the media, see a lot of this in Hollywood, and probably everybody saw it, Madonna. I do not know what she did to her face, but underneath all that, she was a beautiful woman, and you can easily give her a more youthful appearance, not return her to her 20s, but a more youthful and graceful appearance. And what we see now is a truly distorted look. Probably put volume in her face to get rid of her wrinkles. Well, that wasn't the answer, right? Most likely needed a facelift or skin tightening procedure. But again, unfortunately, there's people out there where the desire of the patient or the profits from it outweigh the clinical decision of it. So be smart, know that there are other options if you feel that you need skin tightening, etc. But stay tuned, and hopefully we'll see you in the next video.